Hey, it is Corey here again. I am on my way to work, and I figured that I would talk a little bit about the appointments leading up to your breast augmentation, at least my experience with it. I had researched a few different plastic surgery facilities and doctors, and it's really important for you to make sure that your doctor is a board certified plastic surgeon. There's a lot of these doctors that go to these little, quickie weekend courses and, think that they can perform breast augmentation, but you want to find a board certified surgeon, plastic surgeon actually. So anyway, my first appointment with Dr. Davis, I told y'all he's a family friend, so we did a lot of catching up and stuff as far as how my family was doing and vice versa. Then, he really explained in detail the differences in the kinds of implants, the placement, kind of a little bit about the cost of what it would be, the positive and negatives to both kinds of implants. And for those of you that don't know, there are saline implants and silicone implants. Silicone come pre-filled, saline, they stick the little silicone shell in you and they fill it up. And I'll do a whole other thing later on the kinds of implants that I've learned about. So anyway, he did that and then measured my breast and chest area and to kind of see if one was bigger than the other, because that's very typical with women, except mine were actually even. But I told him when God doesn't give you much to work with, then at least he'll give them to you even. So I'm really excited about the outcome of this surgery. But anyway, went to that appointment, and the fun part was trying on the sports bra with the implants in there. And what they do is they give you a sports bra. It's one of those front closure ones that you'll get for after your surgery. And he starts with, a 200 all the way up to, 400 or 500. I mean, however big you want to go. Since I'm doing, 360 to 380, we didn't really go that crazy. But, and then you wear like a tank top. You bring a tank top to your first consultation. That way you can really see what it's going to look like one of those little wife beater white tank tops or whatever. You can really get a good feel. So yeah, we tried on different implants. He would tell me, you can go bigger, you can go bigger, you can go bigger. I think that's as big as you want to go. So we tried them all on, but of course, ultimately, it's the patient's decision. So that was really cool, and that I was really teetering, and I still teeter in the size. Going, oh my gosh, should I go 20 cc's more? Well, that's really not that big of a deal, 20 cc's. So I think the bigger I get, the bigger I'll want to go. So I just need to cut it off, cut it out. That was so cheesy. Oh my gosh. Anyway, so my second appointment was to schedule my surgery, and I went in and we confirmed the size. I got to try on everything again as far as, making sure I had the right size. That was a little bit quicker of an appointment. We went over, once again, the risk of surgery. I had to have some pre-blood work done because of the blood clotting issue with my mother and why she passed away. But, fortunately, it has come back that I am not prone to blood clotting. You can be predisposed to that. So if you ever get surgery, please it's called the Factor V test. Get that run. That way the doctors just know to keep you on extra. It's called thrombolytics. I work at a medical malpractice law firm. It's called thrombolytics. It helps keep your blood flowing so you don't develop clots and they don't break off and go into your lungs, which is called a pulmonary embolism, and that can cause, heart attacks and brain anoxic injuries, and just all these horrible, horrible things, and death. Pulmonary embolism is usually a death sentence. Wow, that's happy. Anyway, so, okay, appointment to schedule surgery. That's my second appointment. We went in, like I said, we discussed, once again, the dangers, the positive effects of the surgery, if the risks outweigh the positives, or the positives outweigh the risk, and all that stuff. Scheduled my surgery. Well, usually they do a pre-op appointment a week before your surgery. Well, we scheduled my surgery 2 weeks before my surgery. So the following week I went back for my pre-op, which was not much different than the appointment before. However, I did get all of my prescriptions. I got all the instructions for the aftercare, the post-operative care. And, just kind of solidified everything, made a final payment. And so now, here I am. It's Tuesday. I am 2 days away. And come Thursday, I will have a fuller figure. So,